Epic is really a science company now that, from what I understand, is pushing forth a platform that's interesting, especially in oncology, right? So
Yep.
there's a peripheral blood sample where typically you would need a tissue sample in order to diagnose. And from what I understand, you'd usually have to go to two or three different tests, therefore specialists, and then aggregate that information to do what Epic can do today.
Yes, exactly. So this all started in 2018 with our first CLIA product in ARV7. And ARV7 is a product that's used extensively. It's been used over 6,000 times to help characterize prostate cancer patient or metastatic prostate cancer patients' cells. And that biomarker expression that we're getting from the cell is called ARV7. And ARV7 is something that's used extensively to help determine whether or not a patient needs androgen-based therapy or needs standard chemotherapy for that particular disease state. What we've been able to do is expand the utility of our cell-based platform and add a cell-free platform to it to create what we call a comprehensive cancer profile. That comprehensive cancer profile now is going to include the ability to understand protein expression at a cellular level, understand the genomic drivers within that cell, as well as evaluate the circulating tumor DNA that's shedding from the cancer to get a comprehensive picture of what's actually driving that cancer. And today, traditionally, as you mentioned, the patient that's going through a metastatic diagnosis, if you take the metastatic breast cancer as an example, they're going to come out of a disease-free state. They're going to feel maybe off, something's not right. They're going to go through some serum marker work to determine if this, in fact, the cancer may be coming back. They're going to go through imaging with PET scan and CT. If something's identified there, the interventional radiologist may attempt to do a tissue biopsy. And that tissue biopsy is then sent to pathology to understand the characteristics of that tumor at a histopathologic level to understand how the patient should be treated. In addition, in today's world, the uptake of ctDNA platforms has been quite substantial. And so they may look for other genomic drivers that are occurring from the circulating tumor DNA to say, okay, what's the full picture on this patient? As you mentioned, that's a fragmented process. What Epic is really on a mission to do, and what we've accomplished, is taking all of that information and being able to collect it and evaluate it through a single blood draw. And we're really excited the opportunity that has to drive efficiencies within the system, but also serve providers and patients to give them a deeper level of information on what's happening with this cancer and in fact, how to treat it.